In summary, aging is a very, very heterogeneous process. Age of 65 years is the most widely used to define the elderly population. With the changing age structure, proportion elderly in Saudi Arabia will increase. Thus, the problem related to aging of the Saudi population will need to be considered in planning the health policies on an urgent basis. So, discussing about frailty of the elderly, what do we mean by the frail elderly? What are the criteria of frailty? And what are the links between frailty and dependence in the elderly? We generally divide the elderly into three categories. The robust category, which represents 50 to 60% of individuals. And these are the well-controlled elderly that has diabetes and hypertension that are well-controlled. They might have a history of treated cancer, but generally they do not affect their general quality of life. The other category is the frail elderly, which constitute 30 to 40% of the population. These are the people that have decreased physiological reserve capacities, leading to impaired response to stress, at a high risk of overall mortality, loss of functional autonomy, and hospitalization and admission to an institution. The last category is the dependent population, and these constitute about 10% of the population. And these are the people that have disability for activities of daily living. They're confined to their home or institution, and they're dependent and difficult to reverse. So when you look at the elderly, they have to be generally categorized into one of these three categories. And if you look at the robust category, when they have a physiological or physical stressor like a broken bone or an illness, they generally dip and they easily respond back to their normal status. Whereas the frail individual, their response will be much slower and usually not complete. And they could easily become the dependent category with their specific illness. If you look at dependence among older people, there's increased prevalence of dependence, and there's approximately 350 million in 2010, and probably 614 million by 2050. Medicine must modify and adapt to the practice in order to avoid such a dramatic scenario, and the prevention of disabilities and age-related dependency should be prioritized.